Well, it is so hard to believe this Sunday, it marks 2 years since the first case of COVID-19 was confirmed in Oklahoma.
News 9's Tevis Hillis is taking us on a journey about how far we've come as a state with this virus. Today, she sits down with the Commissioner of Health. Tevis, good morning.
Robin, Lacey, good morning. Now, just 2 years ago, when the first case was found in the state, the health department remembers only having 1 day of supply for the PPE, no treatment, no vaccine. But today, Oklahoma sits in a much better spot.
Right now, 56% of the state is fully vaccinated.
Although it's been a rough couple years, I feel like we're really in a good position.
As the state feels prepared for what could be next, fighting this pandemic has come with a constant string of questions, asking what more could they do. A large public concern was about the variant testing happening, but Keith Reed says the public lab is identifying the variants as they come.
We're testing every positive that we identify through our public health lab.
And Oklahomans are concerned about ranking #1 in the country for deaths from COVID. But Reed says this data is kind of misleading. The report is based on the day the death report was written, not the day the person died.
Oklahoma listed 15th when it comes to deaths per capita. And that's nothing to brag about. We're not happy that we've had any deaths in the state. I mean, it's a tragedy.
While the state has seen a decrease in hospitalizations and positive cases, the health department says they want to enter a new phase within the pandemic.
We will continue to monitor the data. We'll continue to keep Oklahomans informed. I'm not ready to say that we're moving into the endemic phase yet. I also wouldn't say that endemic phase is going to be a date on the calendar.
And while we want to get back to normal, the state is reminding everyone we really won't reach that endemic phase until the hospital system is not at risk at all. Live in the studio this morning, Tevis Hillis, Oklahoma's own News 9.